Dr. Jaffe, can you help us understand what biofilm is? It seems to be pretty popular right now in health education. What health conditions are correlated with biofilm presence, and how can our PERC integrative health system help with dealing with this?
It's interesting that biofilms are of great interest to a lot of people today. A lot of people talk about them. They talk about them because the premise of the biofilm is that the organism, usually a yeast, by the way, but the organism is producing a film, that is, it's producing a mucopolysaccharide, it's producing a complex carbohydrate that helps it grow, but keeps other things away. In regard to biofilms, since I ran the microbiology labs at the clinical center, we've been working with biofilms and how to resolve them, how to get the body to consume them and make them put paid, as they say in England, for decades. So many people start with the premise that biofilms are something new and mysterious and resistant and associated with chronic illness. And they are associated with chronic illness because people who have a microbiome and a metabolome, who have a digestion and metabolism that is not functioning well, that is not resilient and tolerant, that is not allowing it to repair and restore, are susceptible and hospitable to all sorts of things. Here I part company with most of my colleagues who fight with the biofilm using a variety of natural and or prescriptive remedies that usually doesn't work very well because it selects the most resistant organism. It's the reason why physicians like myself very rarely would use antibiotics, because that selects the most resistant organism and is indiscriminate, killing anything that is sensitive to it. Because we know that if you have enough of the good stuff, it crowds out the bad stuff. If you have enough of the prebiotics, probiotics, and symbiotics, you do not need antibiotics. In regard to what predisposes people to biofilms, one of the interesting associations that's getting clearer and clearer is that the stomach acid inhibitors, the proton pump inhibitors, the H2 blockers, they do many things that are afflictive. They do many things that I do not recommend, including they decrease B complex and B12 uptake, they decrease magnesium uptake, they set the stage for maldigestion, dysbiosis, leaky gut, repair deficit, irritation, and a shift in the digestive tract from elective protective to survival mode. And I think the reason that biofilms have gotten popular is because they're novel, they're different, there's something to joust with, there's something to deal with. And of course, I want to deal with them by stopping the feeding of them by the maldigestive process and increase the body's ability to produce the elective, protective, native items that prevent and dissolve and resolve and make history out of biofilms. And that includes secretory IgA, that includes mucins, that includes a variety of things that are produced by the intestinal wall so that what it receives is already elemental, that is broken down completely. So in essence, what I'm saying is if you feed it, it will stay, and if you stop feeding it, it will go. So the biofilm has two parts. One is you want to stop feeding it. So you want to eat the foods you can digest, assimilate, and eliminate within a 12 to 18 hour period and without immune burden. And as importantly, or more importantly, you want to follow what the alkaline way to 21st century survival recommends: eat, drink, think, do. And I just kind of want to summarize what I've said to emphasize that the notion that a biofilm is a resistant organism that needs specially aggressive treatment is just bloody misunderstanding. But I can tell you that as a clinician, I didn't learn a fraction about the microbiology of these organisms compared to what I learned when I was in laboratory medicine. But most physicians who are in laboratory medicine are only in laboratory medicine, and they barely talk to clinicians and don't really have conversations about cause and effect, because very often today, after the fact, you see something and you associate the two, chronic illness with biofilm. Therefore, the people who are most chronically ill seem to have the most biofilm. Then the biofilm must be the problem, rather than the biofilm, in fact, is a consequence of upstream dysfunctions. And we want to get upstream to the causes, not fight with the consequences. And so it is with biofilms.